Parkour can be an amazing physical activity, or some would even call it a sport, to watch. And I'm sure it's thrilling to actually be the one doing some of these moves. Welcome to That's Gotta Hurt. I'm Dr. David Geier. Now, if you aren't familiar with parkour, think of it as sort of a combination between getting through an obstacle course and gymnastics. You may run, you may jump, you may flip and vault over all sorts of nearby obstacles, maybe walls and benches, really anything else that's nearby. Now, it's an activity that lends itself to capturing some of these amazing moves on video. But when things don't go so well, you might wish the cameras weren't always on. Warning, some of the video clips you're about to see aren't for the faint of heart. Now, if you're going to jump between buildings way up in the air, you better make sure that you don't come up short. But you don't have to be 30 feet in the air to get hurt. You can slip and fall doing something simple.
Oh, God. Are you okay?
No, Mom, he's not okay. Now, jumping and flipping off a nearby picnic table would be cool if you make it to the picnic table. Then there are the times when you do everything right, but the nearby obstacles and equipment fail you. Watch out, those tables don't look that stable. Neither does that wooden fence.
2, 1, go. Oh, shit. That's why. Shit. Right? Yeah.
Or that metal roof. Or the wall in the school hallway. I bet you're going to have to pay for that. Now, I can't show crashes and falls in parkour without the obligatory groin injuries. I can feel his pain, and this guy's. Concussions may be a problem in football, but I wouldn't want to be a team doctor in parkour either. Watch some of these head injuries. Watching his head snap back, just awful.
Oh, dude. You alright?
No, he's not alright. I could see that one coming. Now for my favorite, or least favorite, head injury in parkour. Better watch out for things that could get in your way. Speaking of things getting in your way, or people getting in the way,
Oh!
or something else getting in the way. This guy just doesn't look like he should even be doing parkour. This would have been awesome if he had made it. And if you're going to try any of these stunts, please make sure that your pants are going to stay on. Okay, that's going to wrap up That's Gotta Hurt with Dr. David Geier. Thank you for watching. Quick update on Minnesota Vikings running back Adrian Peterson. I talked about his meniscus tear on Tuesday. Turns out that he does have what we call a bucket handle meniscus tear. That's the type usually that you can sew back together with stitches. And as we talked about, that's usually about a 4 to 6 month recovery because you've got to get the stitches and essentially the meniscus to heal. The good thing about that, though, is that it potentially saves that entire meniscus as a shock absorber so that potentially you remove or decrease the chance for long-term wear and tear. Short-term, big setback for the Vikings and anybody that owns Adrian Peterson in your fantasy football league, but long-term, this is very good news for Adrian Peterson. Okay, if you have any athletes or injuries that you want me to discuss on an upcoming episode of That's Gotta Hurt, definitely leave those in the comments below this video. Remember to subscribe. Click the subscribe button in the upper right corner of my page. You get daily episodes of That's Gotta Hurt with Dr. David Geier delivered directly to you. Thank you so much for watching, and I look forward to seeing you right here next time.